Good afternoon. County Executive Rich Fitzgerald here, and normally we have our Wednesday at 4 o'clock press briefing and live stream on Teams with Dr. Bogan and her team. We haven't done this on a Monday for a long time, but we just wanted to come, and Dr. Bogan wanted to talk about some of the numbers that we have seen over the last couple of days, including today. This region has kept positive test results very low for a number of months. But as we opened up on June the 5th for the last number of weeks, and we've seen anecdotally and heard reports anecdotally of people not wearing their masks, not always physically distancing, those type of things. We just want to reiterate the fact that we've seen in other parts of the country where people aren't wearing their masks or not physically distancing, we've seen some really high levels of testing go up. It's early. Hopefully this is just a few days of data that will then come back down. But I think there is concern that we need folks to continue to stay vigilant. This is very dangerous and very serious issue that we all need to continue to work on. So I wanted to have Dr. Bogan and Dr. Brink is here as well, the epidemiologist, to talk about some of the things we have seen over the last couple of days as we've seen our numbers start to go up again. Dr. Bogan?
Thank you, Rich, and good afternoon. So today's report of 45 new cases of COVID-19 is concerning. It's the highest daily number of new cases we've seen in more than 2 months. And I'd like to share with you our Allegheny County data and why I am concerned today. First, the number of new cases here this past week more than doubled, from 134 this past week compared to 56 the week before. About 40% of the new cases are among people ages 25 to 49, about 20% among those ages 19 to 24, and about 10% among children. And in the past, most cases were among those over 65. But now we're seeing primarily cases among younger people, those more likely to be out and about in our community. We have not seen a large number of new cases or clusters from recent events and mass gatherings. So in order to contain the virus, it's essential that we continue to conduct case investigation and contact tracing. And fortunately, we built a flexibility into our case investigation and contact tracing teams in order to handle a surge or an increase like we're seeing today. So this is already being utilized in our health department. Our case investigators are hard at work on contacting the 45 new cases reported today, but we don't have information about them, but we do have about the 37 new cases over the weekend. So in about half of those, the person had traveled out of state before testing positive. Some traveled by car, others by bus or by plane. Only 4 people who tested positive had a known contact. 3 are healthcare workers. We have not yet seen an increase in the hospitalizations, but hospitalizations tend to lag about a week behind new cases. So we are watching that very closely. The past few days remind us how quickly numbers can change, how quickly the virus can spread, and how quickly we must react as a community. And as the health director, I'm asking the public to keep each other safe. You can do that by washing your hands frequently with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Business owners, it's a really good idea to have hand sanitizer throughout your store or your facility to encourage employees and customers to use it, and for everyone to wear a mask at all times while inside. Avoid large groups and keep 6 feet away from others. Physical distancing is still an important tool in reducing the spread of the virus. Spend time outdoors. If a restaurant offers outdoor seating, take it. Meet friends for a walk in the park or a backyard rather than inside. Studies have shown that sun and wind both reduce the spread of the coronavirus. And remember to wear your mask over your mouth and nose. I was out this weekend and saw lots of people with masks sort of under their noses. Make sure your mask fits tightly both over your nose and mouth to really prevent the spread. Face shields are another good alternative to masks if wearing a mask is too uncomfortable. Make sure the face mask covers your entire face and extends past your chin. And get tested. If you feel sick, even with mild symptoms of COVID-19, please go get tested. We strongly encourage anyone who knows they've been exposed to COVID-19 to also get tested. And we also would like you to wait about 7 days to get tested after the exposure to try to reduce the number of false negatives that we see. Most testing locations in our county will test people who know they were exposed even if they don't have symptoms. And if you're concerned that you've been exposed but aren't certain or aren't showing symptoms, there are places in the county that will give you a test. It's not a bad idea, especially if you've been in large groups or have traveled out of state. If you're going on vacation, don't take a break from precautions. Even if you're visiting an area that doesn't require wearing masks, please consider wearing one. And opt for non-crowded vacation areas. Most businesses in our county are doing a great job keeping people safe. But for some, keeping their staff safe is a challenge. Cooks working side by side in a small kitchen or employees working together in a small store can put each other at risk. And if one person tests positive, an entire staff may have to go into quarantine, forcing the business to close temporarily. So to prevent that and to keep businesses open, I suggest that some employees work together as much as possible. So divide your staff into groups and if possible, only work employees from that same group together. That way, if an employee from, say, Group A tests positive, employees from Groups B and C don't have to quarantine or miss work. So we've done so well up till now. We've flattened the curve, we've opened stores and restaurants, our kids are out playing again, but I am concerned with the new numbers. But we can fix this. We don't want to close businesses and stores again. We want people to be out and following the rules and guidance. And if we do that, we can all stay open and stay safe. So thank you, and I'm happy to take questions.
The first question that we have is from WPXI. With traveling to different hot spots and then returning home, what could that mean for coronavirus in the county? What should people do when they travel?
So I think I answered some of that with my statements. But again, if you're traveling, remember to wear your masks where you go, to do lots of hand washing, to avoid crowds. So again, a walk on the beach separated from other people is totally fine. But if you're then standing on the boardwalk with lots of people at an ice cream stand close together, that's not so safe. So just be thoughtful. And we know how the virus spreads through close contact, through droplets, through surfaces, but mostly through droplets. So again, if you're avoiding and staying physically distanced from people, you should be doing okay. I know that when I get in and out of my car, I put hand sanitizer on. If I've been in a store, I put hand sanitizer on before I go in the store. I put it on as soon as I get back to my car. I put it on as soon as I unload my groceries, etc. So doing those kinds of really vigilant behaviors really do help.
This next question is from WESA. Can you tell us if there is any backlog of cases that have not yet been reported?
So there's always some lag in case reporting. Some labs report back within 24 to 48 hours, others take a little bit longer. The cases that we're reporting today really come from sort of Tuesday through Sunday testing. So really there's not an alarming backlog, but there's always some little bit of backlog in cases.
You touched on this briefly, but also a question from KDK Television. What precautions should Pittsburghers take if they have gone on vacation and have now returned? What can they do to prevent themselves from bringing COVID back or from infecting others when they return?
Well, first, if you think you might have been exposed on your travels, you can self-quarantine, which would be great, so then you're not spreading it through our community, and go get tested. But again, try to wait from about 7 days from the date of exposure, unless you have symptoms. If you have symptoms, then get tested as soon as you have symptoms.
This question is from Public Source. Given that Allegheny County has entered the green phase of the governor's reopening plan, which has relaxed some of the stricter business guidelines, do you have a sense from the state what could trigger reimplementation?
I do not have any information about that. Do you, Rich? No.
This question is from KDK Radio. Can you be sure that cases are not related to protests, especially since it is young people protesting, and has there been any change in testing rates?
So during our case investigation, we do ask if people have been in crowds, and And only a couple of people who've done any case investigation have reported any presence at the protest. Now, again, people may not be sharing that information with us, but in general, people are quite honest and open with our case investigators. So it certainly doesn't seem to be a large source of our cases. And also, those protests really started more than a couple of weeks ago. So we think that this really isn't from those older events.
This question is from the Tribune Review. Will today's COVID-19 increase influence the county to enforce more restrictions on places that have opened in the green phase, such as restaurants, gyms, or hair salons? Will less people be allowed in? Will places be shut back down?
So we don't have, what I'm really asking, and the reason we're making this public announcement today is really to encourage businesses to follow the guidance as closely as possible, because we're all in this together, right? So businesses, if we did shut down, then businesses would lose out again. So really this is about a community all coming together and following the guidance that we've given in the past, and we continue to. And we are working with small businesses, large businesses, school districts, all in trying to help plan and implement the safest strategies so we can remain open and serve the public.
This question is from WTAE. Is there an assessment about why the 25 to 49 group accounts for most cases?
You know, the case investigations we've done, people have reported being out in bars, in restaurants, being out and about in the community. And so I think it really reflects who's traveling and out in our communities most. It's also people in places of employment, people who are traveling, and that seems to be the group that is probably doing that the most.
This question is from WESA. Are there particular places, testing sites, that these positive test results are coming from?
Yes. So about half of the positive tests were from healthcare facilities and like our hospital systems, and about 30% were from some of our local testing facilities. I'm trying to find the numbers. So CVS and MedExpress had about 30% of the cases, and our hospitals had about 50% of the cases.
I'll apologize if you answered this one. This might be on me. WESA's question is, county data shows that on June 8th, 351 people have been hospitalized with COVID-19 since the start of the pandemic. Today, there's 365 people that have been hospitalized. Is this a significant jump?
No, you know, again, hospitalizations will most likely lag at least a week behind the case numbers, and we have been sort of seeing a steady number of 1 to 2 or 3 new hospitalizations a day, and it's not been a jump as of now.
This question is from WPXI. We've gotten a lot of emails from Rivers Casino employees and family members of employees notifying us that multiple employees have tested positive. Is the health department aware of this? And are there any considerations to close the casino or any other precautions that will be taken?
So we're aware of 2 cases in employees that have been previously reported. Again, the 45 cases that we got today are currently under investigation. So as we know more information, we'll let you know. And we are working with the casino to discuss with them the best strategies to keep people safe while they're there. And that's where we are right now.
This question is from WTAE. How do you square the county numbers being higher today with the statewide numbers being relatively low?
Well, you know, I think we have been really protected here in Allegheny County, and we really didn't see the numbers like other parts of the state. And as people start traveling and coming back to Pittsburgh, you know, I reflect back to our first cases that we had in Pittsburgh in March, and those were all travel related. And we're seeing a similar process now where people have traveled and coming back and bringing new cases. So I think what we're seeing is a reflection of the change in green status here that protected us for a long time, that we're no longer isolated and everyone's staying geographically located. So as we start traveling around the country, as a community, we're going to see cases coming back to us.
This question is from WTAE. KDK Radio. I'm sorry, they're running together on my list. Has our positive test rate increased?
I can't really answer that quite yet because there's often a lag in the negatives being put into our system, and so I suspect there's a small bump, but again, you're looking at a lag in data, so I'll know better by Wednesday, I would say.
And this one is from WTAE. Can you say generally where people are traveling? Is there a specific area?
No, I think I'd rather not comment on where people have been traveling.
This question is from the Pittsburgh Business Times. How many of the cases have been related to either the elections or the protests? You did answer the protest question, so let me throw the elections questions out there. And then the follow-up question is, do you expect that to change with the 45 announced today when you don't have information from yet?
I think it's too late to be from the elections, what we're seeing. And again, there are still protests going on, but certainly the protests of a couple of weeks ago, we're not seeing an effect from that. But there have been protests nearly every day, I think, for the last few weeks. So we'll continue to monitor, and the state questions on contact tracing do ask about where people have traveled, whether they've been in large crowds. And so we will gather that information. If it becomes apparent as part of our contact tracing, we will certainly let you know.
And this final question from KDK Television: how can Pennsylvania prevent a surge in cases like other states are experiencing?
I think the guidance really hasn't changed, and I think we have the ability to really contain the number of cases by continuing our case investigation and contact tracing. That is really the most important part of an outbreak, and it's worked. It's a tried and true method to contain infections, and so Allegheny County never gave up on that. We have done case investigation of every case and contact trace every case, and we will continue to do that. I think that's essential, and we ask that that the public follow the guidance of limiting physical contact, keeping 6 feet apart, primarily visiting folks outdoors, staying 6 feet apart, washing your hands, and really, if you feel at all sick, runny nose, congestion, stay home and stay safe and get tested.
That's the final question. Closing comments.
Yes. Thank you, Dr. Bogan, and thanks for giving us the data, giving us that information. I think Dr. Bogan stated it very well. We've seen a little bit of an increase, over 80 positive tests over the last 3 days. That's certainly much, much higher than we've had in the weeks previously. I think there has been a little bit of a natural relaxation. When we went into the green, we were announced into the green in late May and went in early June. And even anecdotally, you see people, not as many people wearing the masks as they were. And I understand even on social media last week, there was a no mask day. I can't think of anything more irresponsible to be put out there. So I'm hoping people are wearing, as Dr. Bogan said, certainly wearing your mask, keep physically distanced, wash your hands, all the things that we've been doing for the last 3 months and have gotten us into the green phase. Other parts of the state are just entering into the green phase now. So hopefully they'll maintain low numbers, and we want to maintain the healthiness of our numbers of where we have been. We know there are lagging indicators such as the hospitalizations, ICU, et cetera. So we're hoping that doesn't, we don't see those numbers go up in the coming days. And we certainly want to see the positive test numbers continue to stay low and hopefully go down over the next couple of weeks. So let's continue to be responsible for each other, because we are. It's really about the community. When you wear that mask, you're protecting everybody in the community. You're protecting your older parents and grandparents, your older relatives, your older neighbors, all of us, quite frankly. So we all have got to be in this together, and we've done such a good job. And we just wanted to come forth and have Dr. Bogan talk about some of these numbers, and for all of us to have a little bit of a reality check on what we don't want to see happen that's happening in other parts of the country. So everybody stay safe, and we'll be back on Wednesday, hopefully